So, good evening and welcome to SAS Sober and Smiling. My name's Rob. In the room we have
Damon.
Jamie.
and also tonight we've got a special guest speaker. So, as we promised last time, we've got something a bit different for you out there. So, this is episode 22, I believe. Thank you for tuning in. So, tonight's episode, like I said, we've got a special speaker just come into the room and give us their opinion on what effects we have in active addiction on the NHS. So, for my mind, obviously, I can only go from what I know and what I've seen and my experiences through it. I don't know anything about what pressure, what hassle, what people thought about me as a person when I went into hospital and stuff like that, and into doctors. The only experience I had was when I wanted to give up and get into recovery. I spoke to my doctor, and my doctor, to be honest, was totally fucking useless. Didn't want to know, even though the websites say that I'll get all the help and support that I needed and everything else. The doctor just wanted to give me pills. That's all he wanted to do was just give me pills. Even though I'd explained that I'm a addict, not just by alcohol, but by prescription pills. So I would take a dog worming tablet if I thought it would give me some kind of buzz, and I wouldn't take one, I'd take 20 just to get a buzz. And I've openly said that I used to go into customers' houses and just raid their medicine cabinet, and no matter what was there, whether it was anything printed or not, I would just take them because I needed that type of buzz. So for the doctor to tell me that his way of me getting clean and sober was to take drugs was a bit pathetic, really. He didn't understand, and that's the issue. I think that no matter where you are in life, whether you're a doctor or a nurse, or from my point of view, unless it's real experience that you've had, you don't really know how to treat it, because there's a lot of people that go in and out and in and out, and I've seen them myself go into hospital like every week just to be dried out, and that is obviously a total waste of resources. It's a total waste of money, and some people can't be helped. As we know, they have to be helped at the right stage, but nobody knows that right stage, do they?
No.
And that's the issue, is you can treat alcoholism or drugs with rehab, and I think rehab should be free, but how far do you go? Do you keep putting people in left, right and centre, and they can go in 20 odd times and they wouldn't get it? Is that the fault of the person, or is that the fault of the system? Because if you did that and it was totally free, then the system would just break it within a year, wouldn't we? So yeah, it's a difficult one. So there's lots to talk about, and I'm intrigued at somebody else's point of view, because obviously I only know my point of view. So we'll hand it open to the floor, and we'll see where we go with it.
I'll just introduce myself. I'm Maria, and I'm a former A&E nurse. I was in A&E for 16 years.
Oh, yeah.
So obviously my point of view is from A&E and personal views more than rehab and everything.
Yeah.
Because obviously basically a glorified first aid station is A&E. They come in, we sort them out, we chuck them out, putting it bluntly.
Yeah.
But I think in general, because it's A&E, we just treat everybody as an individual when they come in, no matter what the background, the history or anything. We have to treat what we see. The same with the ambulance crews when they go to anything. They treat what they see, and it's only as you're treating patients sometimes that you find out what the addiction is, or what the problem is, or what they're suffering from alcohol, drugs, self-harmers, mental health situations, so
Yeah.
we've had it all.
So you would, if I came in the past, and obviously I'd be off my face, whatever, then, and I hadn't thought about this until you just started speaking, that you would only treat what was going on at the time.
Yeah.
Because me as a person, I'd expect that I'd go into hospital and they'd sort me out. So they'd do all the tests they need to do, they'd do this, they'd do that, and then I'll be on some sort of plan. But that's not the case, is it?
Not necessarily, no. I mean, again, it depends on individual sometimes it's a case of see, treat, discharge, or if
They
needed,
get
we'd
like
refer on to different
yeah,
people.
the mental health team
Yeah.
could come in if needed.
Yeah.
Yeah, we have a
Um,
crisis team that used to come down
Yeah,
to the
that's the one.
department to, for like mental health problems or self-harmers or people that we couldn't deal with.
And do they come there and then, or do they have to go home and wait for an appointment?
No, they come down to the department
Yeah.
there and then speak
Depending
to
on what level they're at.
yeah, and then they'd speak to them and either discharge with a follow-up appointment or admit them, for further treatment.
Yeah.
So it's still a slow process, which as addicts
Yeah.
we're not. If you end up in hospital and you think, well, I'm going to see someone from the crisis team, something's going to happen. It's going to happen today. All right, they might not fix me today, but I'll feel better. And it's just I don't think it's like that. I've had multiple times I've been in and seen the crisis team, and it's I think you get, is it 6 sessions with the crisis team if they deem it suitable, but even they can only offer so much.
Yeah.
I'm sure the last time I was in touch with the crisis team, they wouldn't actually offer me any help because there wasn't anything that they thought they could do that short of what they tried before, and they just referred me to another service. So it's just more waiting.
Well, that has always been my issue with help in any way on from the medical profession is for me the only service I was offered was drugs to try and fix it, which didn't help, or the only other service would be to go to somewhere like Addaction, what used to be Addaction around here, which is just. And I've done a little bit of research tonight, just to have a quick look, and they're still doing it. That they'll refer you to something like that.
I think it's is it Turning Point now?
I think it is, yeah.
That's, do you know what, I did that for quite a few months, and the problem with that is they say it's abstinence based.
Yeah.
But you could go in there every week. I think they do 2 sessions a week. You could go in there and you could tell them that you're still using. It's not a problem. Come in, take a seat, sit down. Do you know what I mean? They tell you to do the grats, you do it's different from CA, but there's also similarities, but once you leave that room, the support stops. It's not like CA where you can still reach out to people. Do you know what I mean? It's like 5 o'clock, they're off the clock.
Yeah.
You know what I mean? And it's like they're just doing their due diligence, what they're paid to do, and that's fine. A lot of people do the job and nothing else.
But that's also where you go and get like your methadone from and stuff, isn't it? If you're a heroin addict.
Well, yeah, I went to Addaction a couple of times, and it failed because I'm an addict, and any addict will fail at something like Addaction because they don't. I don't think they understand it. Really, they think it's a physical disease, and it's not. It's a bloody mental disease. B, they want you to reduce your intake, which doesn't work. It's either all or nothing, and that's the only way to deal with recovery is all or nothing. So you can't reduce it because you lie. I was just given a bloody form to go, I've drunk 2 bottles of wine in a week, which is bollocks. I've done that in a day. And I'd just lie all my way through it, and that'd be. And as far as I'm concerned, it's just a tick box. For people like that, it's a tick box to get you in and out.
That's what they do in the job, the tick boxes. There's no real, there's no sort of real aftercare.
No, and I know a lot of people not in recovery, but are trying to get in recovery and have been in and out loads and loads of times, and they use your service, the hospital, as a drying out session, a bit like the Hollywood stars do with the Betty Ford Clinic and stuff like that. It's not to get in recovery, it's just to get sober and clean for that amount of period of time, and then they come out, they go back to their drinking, drug use, and then they go back in again after a few months. They just treat it like it's just like it's your job to just dry them out, which is totally wrong.
A detox clinic.
Yeah, and it's not. It's the NHS. We're struggling as it is, and the nurses and the doctors are struggling because there's no bloody appointments and there's not enough people. And I can see it from the normos point of view out there that we are we're a burden on society.
How big is the addiction problem from your time in A&E?
For me, I would say, I mean, everybody says, oh, A&E, you know, you get all your druggies and your pissheads and everything, but it was your normal going out drinking people who've had too many beers coming in, and 9 times out of 10 it was relatives and friends that was the problems that caused all the aggro. With drug addiction, it wasn't so much the addicts that were coming in with fix-its, it was more your ODs when they'd had to dodgy batch or they've had too much.
Yeah.
But 9 times out of 10 it was Narcan. Wake up, they'd take their own drips out and go, really sorry, bye.
But,
Yeah,
I mean,
sorry to be a pain.
it-
And we probably wouldn't see him for months and months and months. And then
It's-
we'd see him on probably 4 times in 1 week again.
Is it a bigger problem than people realise, though, than normal people? Because, you know, as addicts, we know it's a major problem.
Yeah.
'Cause as an addict, you can spot an addict. You've got like a radar, do you know what I mean? You can see them. But I'm just curious, as you know, for the normal people out there that might be listening, is it as rife as?
From an A&E aspect of
Yeah.
personally, I don't think it's as big a problem as what media and everybody make out. Because
Okay.
obviously, you know, you come in and we sort like with the drug addicts and overdoses.
Yeah.
If needed, they'd be admitted and
Yeah.
obviously further care as an inpatient. But like I say, 9 times out of 10, they'd wake up and just sort of really be apologetic and, you know, really sorry, you know,
Yeah.
thank you for everything you've done and be on the way, you know. Sort
But
of
do
thing.
we need? That's a good point. Do those type of people? Because I think there's two types of, for me anyway, there's 2 types of people that will go into A&E. There's people that go into A&E because they've had a skinful that night.
Your binges.
Your
Yeah.
binges, and
They're the problems
then
more than anything.
they're totally schizo and they're panicking and everything else. And then you've got the real people that go in because they're committing suicide or they want to commit suicide or they've drunk or taken an overdose.
I think the fact that if people are nice when they leave, if it is the latter of what you've just said, you know, if you've attempted suicide and then you're really nice when you leave, instead of saying, why did you save me for? I mean, that there is, I don't want to die, I just want some help.
Yeah.
You know?
Almost virtually all suicide is a cry for help, isn't it?
It is, but I mean, you know, I like to think that, you know, there's a point where you can take too much and, you know, it doesn't matter what they try and do, you're not coming back, sort of thing. Do you know what I mean?
Yeah.
It depends, because if you really want to commit suicide, you don't tell anyone, you do it by yourself.
Exactly, yeah.
You know, I've had overdoses, but I've always told someone.
Yeah.
I don't call the ambulance, you know what I mean?
Yeah.
Somebody else does.
But someone else will. But it's not. It's like, I don't want to die, but if this is how serious I've got to be for someone to look at me and think, God, he actually does need some help, and it's not just,
Yeah.
you know, in a bad place. Do you know what I mean? But that's really bad. Do you know what I mean?
But like I say, the NHS is overstretched, so it's get you in and get you out, and I feel it's the same if you go to like the doctor's surgery. You know, I mean, I know I've manipulated the doctors in the past because I thought I want some tablets, and you look online, come up with a couple of symptoms, you go sit in front of a doctor, tell him your symptoms that you found online. Within 2 minutes, you're walking out with a prescription for strong painkillers or some mind-altering substance, and as quick as you're in, you're out. And there's I think there's a gap a gap there as well, because I don't feel like that's done properly. And you know, in the past when I've been to the doctors and said I've got a drink and a drug problem, they've told me to cut down, which again we know is absolutely crazy and you can't do it.
Yeah.
And I've also been to the doctors before when I was deep in like cocaine and drinking addiction. Yeah, that's when my depression and my anxiety started to come in. I thought, right, I need to go to the doctors and get help with this. And then I go to the doctors and I'd just sit there in line and said, right, okay, what's going on? And I'd tell them, and they're like, do you drink? I'm like, not really. Do you take drugs? I've never touched them in my life. You know, so I've lied to the doctor. Then they give me tablets to muck about with my dopamine and my serotonin, and I'm still taking drink and drugs. So I'm just adding to that cocktail all the time. Then you had a couple of painkillers in here, with a couple of this and a couple of that, and you can see why you get out of control with it.
Yeah, and I agree. I think the doctors should be the first point of call for anybody, and logically it is. That was my first point of call, with my wife marching behind me to make sure I went, is to go to the doctors, because you and I went at a time when I pinned all my hope on the doctors fixing it.
And was you honest?
I was totally honest, yeah.
Yeah.
Yeah, because, I mean, like I said, I had my wife sat next to me because she'd obviously had enough. And I was totally honest. I broke down and everything else, and I told him how bad it was and everything. And he gave me a frigging leaflet for addiction.
Yeah.
And that was it. I
And a
walked out of there.
prescription.
And yeah, I could have got a bloody prescription. And I think the doctors is got to be, they've got to take all those cases before they get to A&E and before you have to deal with them. Not what we classify as the serious ones, like the overdoses and stuff, but the general person that is struggling with addiction,
Looking for help
the
before he
doctors
gets
should be
that
able to stop that, should they not? Or stop a majority of it by asking the right questions, doing tests, because I bet you weren't even given a blood test to see if you were drinking.
No, that's
or
what I mean. They don't. That should be like standard procedure, right? Okay, you want some of these medication? We'll do a blood test to see if any drugs crop up in your system first.
Exactly.
It's a 2-minute job.
Do you drink, sir? No, not at all. Right, let me do a test, and we'll find out how much alcohol you've got in your system.
Yeah, how bad it is. Yeah.
I think you've answered your own question in something you've said already, because you said yourself addiction is not a physical thing, it's a mental thing. Doctors, they are, I like to think that they're trained in physical ailments. They're not, you do need to see a specialist for, mental ailments. It's not something doctors can generally deal with. So, yes, they'll do you a referral, but all they know how to do in the meantime is prescribe that antidepressant, so this might make you feel better.
Yeah, but then again, that antidepressant, again, it's just a temporary solution to the problem. It's not resolving the problem.
It's not, but the doctor hasn't got the, I'm going to say, intelligence or the knowledge, I would say.
You just gone there.
Yeah.
I agree with something.
The doctor hasn't got the knowledge.
The knowledge
to go down that way of thinking.
But an antidepressant for me would be fucking yes. Let's have some, because I'll abuse the fuck out of it. Whether it gives me a buzz or not. If a doctor went, yeah, you need to take these, I'd go, yeah, okay, and then I'd push it.
Yeah.
And I'd push it and I'd push it.
But
I'd give it a couple of months, and then I'll think, fuck it, I'm taking 2.
Yeah.
And then another month will go past. Fuck it, I'm taking 3.
And then ring
4.
the doctor up and tell them these aren't working. Then they give you some more to go on top of them. I ended up on about 3 or 4 antidepressants and anxiety tablets at one point.
Yeah, exactly.
And then but they were, but they didn't tell me to stop taking one. They just said, "Oh, try that one."
Yeah.
So I was taking that one and that one and that one.
But and also, if it is as we know, it's a mental disease, like you said, then surely the referral should be to. Is it psychiatrist? Is that?
Yes.
Psychiatrist.
But again, you've still.
Surely
gotta
that's
go,
cheaper than us going to where you work.
But you've still got to go through the mental health team, who will then
But then again,
refer you to who they think the correct services. You can't just go and say, right, I need to see a psychiatrist, because he'll just refer you to the mental health team, and then they'll decide where to refer you.
But
to.
again, I don't feel like they can really, because in the past before I've been in rehab, I've been to see a psychiatrist, I've been to see a therapist, and they've all, I've been referred, and they've all said, yeah, these will help you out, because it's a, CBT or whatever they want to call it. But I'd go and see these people, and they've been to university, they're probably very good at the job, but then you talk to them about addiction, and they just tell you what a doctor says. Well, just you need to cut down, I've walked away from those appointments so many times frustrated, thinking you're trying to tell me how my head works, and that is not how my head works. Because because like I say, I feel unless you've kind of lived with addiction, I don't really think you're in a position to actually help somebody.
That's the problem, though.
No.
How many addicts become psychiatrists, doctors, nurses? It's not. It's usually when you're young when you're doing that stuff, and that's when you're in your addiction. If most people, if they go into sobriety, it's when they've hit rock bottom. It's when they've got older. It's when they've realised that they're left by themselves after everyone's left them.
But I think for me, I mean, obviously I went into rehab, and I think it's 2 stage. So the reason why rehab worked for me is because it's totally run and totally the staff are all ex-addicts.
Ex-addicts, yeah.
So they know exactly what they're talking about.
Yeah.
And they know.
In a weird way, you've actually got respect for them, because they've been where you've been, haven't you? When
Yeah,
you've got
exactly.
someone sat there that's trying to tell you what to do, and they've got no idea what goes
Yeah.
off in your head on a daily basis. It's a bit hard to want to listen to them.
Yeah,
And as soon as they say, just, you need to cut down, that's it. I just switch straight off. 'Cause I'm
Well,
like,
exactly, because I mean, an ex-addict would know that that's fucking impossible, and that's a waste of their breath. The only person in the rehab that wasn't an ex-addict was my counsellor, that I had to have sort of like twice a week sessions with, and I just lied to her, constantly lied to her, just to take the time away, and B, because I had nothing really to say to her, to be honest with you, because for me, all she wanted to do, and all psychiatrists want to do, is pin something on your childhood.
yeah.
And that's all they want to fucking do. And for me, that I didn't drink because of my childhood. I know why I drank, but she wasn't interested in that. She just wanted to pin it on that, whatever. My dad abused me, or I was treated wrong, or I was bullied,
Yeah.
and then it gave them a reason. Addiction doesn't have to have a fucking reason, not really, not a solid reason that they're looking for.
No, that's to say you've either got that gene in your body, which kind of, you can drink sensibly and take drugs sensibly or not.
Yeah.
Because like I say, from from being a teenager, knocking around with friends of mine, say there was 10 of us, and they all lit it as hard as I did through the teens and 20s, but then when they come to like 30, got married and had kids, they all knocked it on the head.
Yeah.
There's only me and one other person that's got an addiction issue. So what does that, so that says everything to me, that it's, it is a gene.
Yeah.
That you're born with.
Yeah.
Because
I mean,
if drink and drugs are addictive, then the whole planet would be addicted to
well,
it.
exactly. You've just said it, and that's what I was going to make my point as, that for me, there is no such thing as a substance addiction. Because there isn't. To me, there isn't.
No, I agree.
I'm not an alcoholic. For me, I'm not an alcoholic. I'm not like a drug addict. I use that stuff, or use that stuff in the past, to mask something else that was going on.
Yeah.
And luckily, in recovery, I found out what that shit is. But the drink, the drugs, and everything else was to take away all that pain that I was hiding, or burying deep inside me.
Yeah.
Until people realise that it's not the fucking substance that's the problem. It's behind that shit that's the problem.
It's like a coping mechanism.
Yeah.
It takes away that choice. Do you know what I mean? It's if I had a choice, then yes, I'm choosing to do these drugs. But when I feel like I have to have these drugs, or else I won't get through a day, it is a different.
Yeah. I mean, we'll get back to the NHS thing. You don't have to answer this if you don't want to, by the way.
I told you we'd reel off.
Yeah, we always reel off. I would expect, because of the pressures of the job, that there'd be quite a few issues in the profession, that there are a few people out there that are addicts themselves. So they should know better, shouldn't they?
Oh yeah, definitely.
Yeah.
Definitely. And I do think NHS-wise, nurses as well as doctors don't get the training to deal with addiction problems. Obviously, we deal with the there and then, but
yeah, you
like
deal with the physical stuff, don't you?
Yeah,
Really, yeah.
Yeah, definitely. And doctors especially, they're just like blinkered and everything. Because I mean, we've had situations where like addicts have come in and the doctor saying, "I can't get a needle in, I need a cannula," and it's like he's telling you to get one in the back of his arm.
Yeah.
He's going, you won't get in one there. It's like, listen to your patient, for goodness
Yeah.
sake,
They know where the veins are.
Oh,
don't
God,
they?
yeah.
Listen to your patient.
Yeah.
You know. But,
It's got to be hard, though, isn't it? It's got to be really hard seeing. I mean, it's
frustrating as well, because I think because I've lived with an addict. My oldest daughter's, her dad was an addict. He wasn't when I first got with him, but again through family pressure and his mum dying and having cancer and dying, he got involved with his older brother who was a drug user, and he became an addict. He ended up drinking and everything sort of thing. So I've lived with addicts, and so I think because I've got the T-shirt, so to speak, maybe I was a bit more compassionate with drug addicts when they come in. And
Obviously, people go into nursing and professions like that because they care. Does that feeling sort of over time when you see like the same old people come in, or even just new people, and do you have to Because obviously, you know, you can't take that feeling home with you anyway. But does that sort of feeling disappear? Do
No.
you end up going to work and feel like I'm just going to go do my job?
No. Yeah, you do, but you get there and you think you just go into nurse mode again, sort of thing.
Yeah. I mean, it's got the point you just made. Yeah, it's got to be hard because I mean, I never.
My first overdose I dealt with was a young chap who became one of our regulars. He'd come in for a few weeks, disappear for months, and he'd come in. And my first encounter with him, he'd been in, he'd had 2 lots of Narcan in the ambulance. We got him in resus, got him on Narcan, and he went, "What you fucking done that for?" I went out again, sort of thing.
No.
And then we gave him some more. He woke up, he went, "I love you, I'm going to marry you." And every time he come in, he said, "I'm going to marry you. I'm going to marry." Unfortunately, one day he came in and we didn't get him back. And we all had tears that night, you know, so because we got to know him, we used to joke with him. He'd bring us a box of chocolates every now and again. He said, "Oh, sorry for being a pain last night," you know. And one night we just didn't get him back, you know, so...
Okay. Yeah.
You
See,
know, so you do get to know like your regulars sort of thing, and you know how to interact with them, and you know, you can with any patient really. It's either Mr. Smith or you can say, "Oh, you fucking arsehole," you know. Do you know what I mean?
Yeah.
It's reading people, but doctors are the worst for doing it.
well, that's really good to know because I'd naturally think that you'd get pissed off with people like us coming in, wouldn't you? I would. I know I would. I'd think that you selfish fucker, you're back again.
I think it's that, like I said to start with, treating everyone as an individual.
Yeah.
You know, you can't treat this, you know, this drug user the same as that drug user. You know, because everyone's got a different story to tell anyway. Similarities, but you know, a different story. So
yeah, well, everybody has got a different story, you know, and a different way of, or you know, a different level of addiction. Because, you know, for me personally, when I was doing, you know, that much cocaine, you know, when I wasn't taking it, you know, between that gap between coming off to getting back on it again, the pain I used to get in my head here, it was like I was being cut with a razor blade. But I went to the doctors, told them I kept getting really bad headaches, then they prescribed me mirtazapine, like a really strong one. And I went that far with it, knowing full well what it was. I ended up going for brain scans at Boston Hospital, everything.
No.
But I wouldn't, but I wouldn't tell them.
Yeah.
What it really was that was doing it. I was just kind of going along with what they were telling me to do to get my missus off my back because I didn't want her to know what I was doing. You know, so there's people like me that do that sort of stuff, you know, and it's madness really.
That does actually bring me to a question I've just thought of. In your opinion, do you think there's a lot of secrecy when people go into A&E? Do you think, well, will people go in clearly on drugs but lie about it because they're scared of what people might
Sometimes,
think?
especially like your bingers that are out like drinking with the mates and have, you know, the cocaine and everything. Well, I've been out a bit. What you've been out? No, really, mate.
It's
you
going
know,
to show up in a blood test,
yeah,
mate.
Because they don't want,
well.
you know, especially if they've been brought in by the police as well. They run out, you know. So and yeah, they will lie. It's like, yeah, all right.
Well,
Then.
yeah, and the jaws on the other side of the room.
Yeah.
but again, that's wasting more resources and more time trying to
Again, it's people, especially personally, it's people skills. We'd have like 4 policemen bringing somebody like handcuffed to a trolley who's kicking and effing and blinding, you know, effing pigs and all this, and I just get down near the rear and I'd go, shut up, and I'll get rid of them. And as soon as the police left the room, they were fine and going, like, what you had? And they come clean, sort of thing, you know, say, well, I've had this and I've had that.
See, I can see that side, you know, of like pissheads and drug addicts coming in, like the violent ones.
Yeah.
You know, I can see that being not very nice because obviously, you know, but for me, it never made me violent. It just made me daft and stupid and more clumsy. So, but I wasn't a violent person. So if I ever went into hospital, which I did quite a lot from broken bones and stuff, from being pissed up or whatever I was doing.
See, I always try to be nice to the NHS staff, but again, fuck the police. If I ever got took in by the police, I was giving them shit, mate.
You never.
I can imagine that.
Like, good cop, bad cop, mate. You're the dickhead, mate. He's been nice to me. He's all right. You fuck off.
Well, that's the issue, isn't it? I mean, I always went into blackouts, so I had a blackout virtually every single night, and I wouldn't know what the fuck I was doing. Really wouldn't. And I I always sort of like woke up not realise, especially the early years. I always woke up in bloody police cells and stuff like that, and different and strange places. And most of the time, I'd always kick off.
But again, the
I'd
police,
always be in trouble, and I had punched someone or done something really sort of like nasty to people. But I wouldn't have a frigging clue. I'm not like that normally.
see,
But that's
police don't understand addiction either. All they
No.
see is the crime you've committed. They don't understand, you know, what's going on up here. They just see, oh, he's committed a crime. We're going to be the police. We're not going to be counsellors, or, you know, we're not going to try and point him in the right direction. We're going to tell him what he's done wrong and tell him his day in court. So, I mean,
well, that's the problem. They could throw the book at me and do whatever they wanted to if I'd kicked off and whatever I'd done to somebody. But I'd have no recollection of it because I was in blackout mode. And the police and stuff and the courts don't understand blackout mode.
No.
I had no preconceived idea of what I was going to do to that person or whatever while I was doing it, before I was doing it, after I was doing it. Nothing. So where does that sort of like stand? Because as far as I was concerned, I woke up in the morning with a clear conscience.
Yeah.
Because I hadn't done any of that.
And it's funny you say that because there was a documentary on a bit ago, and it's about an American prison, and like 60 or 70% of the people that was in there, that were in there for murder or for crimes that they committed, there was all under the influence of drugs, and they can't remember doing it.
No, they wouldn't.
And there's this thing going off at the minute. I mean, it was a while back now, but there was looking into it to see if there was a way around it, because they was trying to prove that, you know, the person that, you know,
that did
drink and takes drugs is not the person you sits here today. Which is true, because it's like that Jekyll and Hyde, as they call it.
If you're in blackout mode, proper blackout mode, and I've had it before where I've apparently wielded sort of like golf clubs at people and done a bit of damage and everything else. But
that's where you'd go from murder to manslaughter and stuff like that.
Yeah.
But quite easily, because I'd have no control over what I was doing.
Yeah,
absolutely none,
I never
and
knew
no
what I did,
recollection, and to be honest, no guilt. Because
No,
I woke up
because
in
you
the
don't know
morning
what
because
you've
I
done,
ain't got a clue.
And then the funny thing is, you wake up in your bed in the morning, your clothes are folded on the floor,
Yeah,
everything's neat and tidy. Like, how the fuck have I got here?
it's mad, isn't it?
See, I never felt like that. I always woke up feeling nervous about who had said what to, because I knew I would have come in them blackout modes, and I get told. So I'd wake up, and I wouldn't remember anything, but I would automatically write, you know, I need to find out what happened last night. And if nothing bad happened,
But you'd never know what happened last
I would
night.
be shocked and astounded. Honestly, I would be shocked.
It never
and
come.
astounded.
Well, I don't know about you, but it never come back to me.
They never did.
So blackouts never came back. I could have quite easily, stabbed somebody, and I wouldn't know. To this day, I would not know what I'd done to somebody.
Well, I mean, like, someone would tell you though. If
Somebody would tell me, but because I wouldn't know and have no recollection of that, and this sounds really
still don't
harsh
make you
and
feel
horrible.
anything.
Why would I feel? This is really horrible. But why would I feel guilt or shame over something
Well,
that
we're
I've
getting
got
on bad
no
side of you,
idea
mate, honestly.
what I've done?
I get that. Yeah,
I'm glad someone gets it.
Yeah.
I'd obviously feel guilt and nervousness as soon as I wake up, and that was like an every morning thing. Every morning I woke up, I'd think, for the first 10 seconds, shit, am I where I'm supposed to be? Am I?
In my house.
Yeah.
Am I fully clothed? Am I whatever?
Have I got my phone and my wallet?
Yeah. And as soon as I know that,
It's like, phew.
then it's like all bets are off, because
Yeah,
I don't
that bit of
fucking.
wife lying
I've got
next
no
to me.
conscience of what I've done. You could shout and scream, and my ex-wife did it, and my ex-wife used to shout blue murder at me in some mornings and go, "You did this and you did that and you did this," and it's just like, I can't remember.
Yeah.
What can I do?
Yeah. You don't know. Yeah.
How am I supposed to say? I'm not gonna go there. But it's like, how can you say sorry to something you don't remember doing?
Yeah. I know what you mean.
I need to see footage. I need witnesses.
The thing is, even if you saw yourself doing it, you'd think, well, I don't remember. It'd be weird because you wouldn't remember yourself doing it.
No, in normal waking time, I wouldn't hurt a fly.
Yeah. Well, that's what they say about that Jekyll and Hyde, isn't it? It comes out when you drink and take drugs, and it's different for everybody. Yeah.
It's quite scary when you think about it too much.
It is
isn't
really, yeah.
Right, we are, believe it or not, we're up already. Up on time.
Told you,
It goes so quick, it's unreal. Thank you for that. Thank you, Marie, for coming in. That was it was really good.
Yeah, I hope it's
Yeah.
a bit of an insight anyway. So.
No, it's really good to get the other side because obviously we only have our opinion of what we do and everything else. It's nice to get the opinion that you all still care, to be honest with you. Because I'd expect to go in and them
be
not.
brushed under the carpet.
Yeah.
I haven't got a bad opinion as such. Just an opinion of a lack of knowledge and training leads me to believe that you can't always trust going to a doctor's or hospital because you're still going to be in the same position when you come out.
Yeah.
It's not their fault.
No, exactly. So, thank you for listening. Please have a like and a share on our pages. So we're on. Nick's not here at the moment, so we are on Facebook, Instagram, TikTok, and something else.
It says Twitter, but it's X.
Twitter.
And YouTube.
Obviously, yeah. So
please like and subscribe.
Please
to
like
YouTube.
and subscribe. We're here at Holton Hill in Skegness, so we'll see you next week.
See you next week.
Thank you.
Bye-bye.